Yeah, I believe that across Europe we have some problems on access to medicines, and we really need to deal with it. Mostly related to policy making at European level, because we have some inequalities within the region, and we need to address those inequalities. I believe also that we need to have better policies, not only on access to medicines, but also on access to care, and finding new ways of redesigning the way that we are providing care to maximizing the potential of drugs that we are using at this moment. Well, we don't have any data to support it, at least at my knowledge. What I believe is that really we need to maximize the potential of the amazing drugs that we are now developing, mostly by redesigning the way that we provide care. I think the highest restriction that we have to better care is the way that we are providing it. And actually, we continue to have a fragmented way of providing care, and we need to have a view that is more patient-centered and more integrated towards patient needs. No, we are talking about amazing technologies that 10 years ago it would be unimaginable to think about them. And you really need to find ways to support it financially. Actually, they are quite expensive at this moment, and we need to find ways of talking together or to join or to bring together politicians and pharma industry, of course, providers, to find ways of reducing those costs and to increase access. Now, this initiative has more than 10 years in Portugal at this moment. But what we have done is to develop a way of paying family doctors, for example, in the data or the outcomes that they achieve, for example, in cancer screening. And actually, we increase the number of patients that are screened in colorectal cancer, and breast cancer, and cervix cancer. And actually, we have very, very good data at this moment on this. Actually, also in the hospital sector, we have some innovative ways of paying for hospital care, where we develop systems where we are paying per patient and not, for example, per surgery or for medical appointment or for radiology session. So actually, we are paying hospitals to have the full package of services, including medicines. This way, we increase the potential of the hospital to redesign care, and actually at this moment, and when we start to pay per patient, we really are increasing the potential of the hospital to develop patient-centered care. No, actually, I believe that all NGOs are doing a fantastic job on this area, and they are pushing access to real novel medicines. What I believe is that really you need to find ways of bringing together politicians at the European level and also pharma industry and providers and, of course, practitioners to find ways of increasing the access to this kind of treatments.